Hello, my name's Julie McCrossan and I'm here at the National Particle Therapy Symposium 2021 at SAHMRI, the South Australian Health and Medical Research Institute, and with me is this gentleman. Can you introduce yourself?
Hi, I'm Scott Penfold. I'm the lead medical physicist for the Australian Bragg Centre for Proton Therapy Research.
And you have just been the chair of a comparative planning workshop as part of the preparation for proton therapy coming to Australia. Can you just explain to me what was the purpose of your workshop and who spoke?
Sure. The purpose of the workshop is really to gain experience with proton planning here in Australia. It's a new technology and it's something that we need to work on before proton therapy gets introduced to Australia. So we have presenters from Peter MacCallum Cancer Centre, Western Sydney Local Health District and the Royal Brisbane and Women's Hospital, and here the team in Adelaide as well presented some cases.
And my impression as a patient was that it's all about when proton therapy is available in Australia, people will do planning for various kinds of conventional radiation therapy to treat a cancer and for the new proton therapy, and then a multidisciplinary team decides which is best for the individual patient. So you're, in a sense, practicing, preparing for both, planning for both, and deciding which is the way to go for the patient. Is that it?
Yeah, that's right. So Medicare here in Australia have required that we have a photon plan, a conventional radiotherapy plan, and a proton plan before any patient is able to be reimbursed for proton therapy. So we need to do this when proton therapy arrives in Australia, and so we're really gaining some experience at this stage, 3 years out before we start treating.
So for radiation oncologists, radiation therapists and other team members and patients and family with a passion for this new technology, what are 2 or 3 reflections, observations, thoughts you have from this very initial go at people sharing their comparative plans?
Yeah, I think there are a number of important takeaways. Centres did approach the proton planning in different ways, but they also approached the photon planning in very different ways as well. And comparing the dose distributions, there was an equal amount of variation in the photon planning outcome as there was in the proton planning outcome. So it just goes to show that there is variation in practice, and national consensus guidelines will really help tighten the best case scenario in terms of generating really high quality plans for the benefit of the patient.
Yes, if I could say how I understood it, and you correct me if I got it wrong. As a patient, I was thinking, what people would think was the right thing to do right now would vary depending on where I was being treated, whether it was Sydney, Melbourne, Queensland, Adelaide. Good teams of clever people might come up with different ideas about, for example, how much healthy tissue might need to be hit, or how much of the tumour would need to be hit hard. Those sort of practical questions that can have a big impact on the patient's body. Is that right, that there's a lot of variation at the moment?
Yeah, so for this particular case was a base of skull chordoma, and it was in a very challenging location, so the target volume was right next to some very critical organs at risk. And in those cases, the clinicians always need to make a judgment as to how much of the target volume they want to cover with a prescribed radiation dose, and how much dose to critical organs at risk they're willing to accept. So we deliberately chose a very challenging case to push the envelope in terms of showing this variation in practice.
And did you show also what actually happened to that real patient, I think in the United States? Was that part of the exercise?
Yeah, so we were able to compare dose distributions planned here in Australia with proton therapy with the dose distribution that the patient actually received in the US when they were treated previously to this workshop.
So what, in a nutshell, are you going to be doing over the next 3 years, which is about how long it's going to take for a patient who's treated at the new Australian Bragg Centre for Particle Therapy and Research?
Proton
Therapy and Research. What are you going to do between now and then to try and make sure any patient that is treated in Adelaide gets the best possible treatment?
Yeah, so one of the work streams that we're working on at the moment is to develop a national consensus guideline on comparative planning, so provide real guidance on how to do that so we have consistency and high quality. But we also need to set up national guidelines and consensus documents in terms of contouring for these very rare cases. And that's something the clinicians I know will be working on hard between now and 2024.
And my final question, nothing to do with proton therapy, is what you've actually just done is seen each other's plans for conventional radiation therapy, and there were variations. So is it possible that this process of preparing for proton therapy initially in one location in Australia might cause an improvement in the conventional planning, because you're going to be seeing a lot more about what each other do?
Yeah, I think that's something that we've all taken away from these workshops, is that there isn't really another common mechanism through which different centres see how each other are delivering and developing treatment plans with conventional radiotherapy. So it does provide a useful side effect, if you like, that we get to strengthen our conventional radiotherapy planning skills as well.
That's the kind of side effect I like, the only one. Thank you so much for talking to us. Thank you.
No worries.
And that's farewell from the National Symposium on Particle Therapy here in Adelaide at the South Australian Health and Medical Research Institute.